Before you started doing this job, what were you doing beforehand?
I worked on the wards, but prior to that, I was 14 years in education.
Doctor's receptionist and a dental nurse.
I left the children's ward in 2017 and went to eyes outpatient.
I joined NHS 2017 as a bank, as healthcare support worker. And then I secure my permanent job in eye department.
What attracted you? Why did you think, oh, I'd like to do that?
It's so interesting. There's so much to learn with eyes. It's just brilliant. It really is.
I was thinking working in orthoptic department, it might give me new skills, widen my knowledge and deepen my understanding when it comes to ophthalmology.
The different variations of eye problems.
Uh-huh.
And it wasn't just like your personal care, etc., like that. It was you was being involved in doing like the visions, the drops. It was you felt more of you was doing something.
Now that I'm in ophthalmology, I don't intend going anywhere because I've always been bored in the same job. So you do a job for 2 or 3 years, get bored, look at something else. But there's so many things here that I think I can do, staying with eyes.
What makes it good to come to work?
We all help each other. So we all, if somebody's struggling on one part of the job, we'll jump in and we'll help each other. It's nice working with families, with children. It's just a nice environment to work in. It's lovely. It is.
It's a challenging, but it's you have to be used to it. Yeah, especially for the kids. They have like some kids, they have that challenge behavior, But I love doing it. Yeah, I love, my passion is helping people, either children or adults.
It's the best out of everyone I've had, and I'm not just saying that, but I really do like it. I like the mix of clinical and administration. There's always something to do.
To me, it's still, even every day I come in now, it's still a wonder. It's like how you get the result of this child or this young adults, make them see better.
Seeing the smile on their faces. It's working with like the optometrists. Is the whole team. It's just brilliant. It is. Even like because we work with the emergency eye clinic as well. If you've got any problems in the glaucoma clinic, it's everyone just works as a team and they work really well together, even the consultants.
A lot of the patients come in and say, what a lovely atmosphere we are.
What kind of training and support did they put in place to get you to where you are now?
I think you've got to learn, you've got to do, not just stand and watch, and the fact that they're happy for you to try things.
You're always learning something, but yeah, you have to be trained, like you have to shadow, you have to be trained, you have to be signed off before you're allowed to do it on your own.
The dilation drops, with putting the cyclopentate in the children's eyes and the proximethicane, that was a sign-off process. You had to do so. You had to watch so many. You had to be observed, and then you had to be competent to do that. Also doing the key there in the case, we do the vision test on the children as well. So that was a bit of training involved in that, which was quite intense. And because trying to get children to concentrate is quite difficult, isn't it?
Learning with like fundamental ophthalmology, we have knowledge already to explain to patient what's going on, why they are there, what happened.
If we need any advice or anything, there's, as well as the orthops, there's everybody else you can ask as well. You got the doctors, you got everybody, the optometrists, everybody.
You've got that nice relationship as a consultant and as assistant. They don't really look at you as an assistant. They talk to you on that level of respect.
Do you think then you'd like to progress to either a band 4 or just to do more?
If you want to, you can progress. There are different fields.
It's really like for us, it's promising that band 4 in the future, and then if we need to learn or to study more to get it, we're willing to do it. Just for a personal progress as well.
You're working in a department that's so complex with like the eyes, etc., like that. I think you should have a good, solid base of knowing what you're actually talking about.
Fitting the prisms on the glasses as well. I'd like to be doing some of that. Just helping out the orthoptists a lot more.
It is a job, but I'd like it to be a career.
If there was one thing that you would say to someone considering a career as an orthoptic assistant or orthoptic helper, what would that be? How would you sell it?
It's a good career move if you like to learn, I think, because there's such a wide range of things that you will learn in ophthalmology. You know, there's not just eyes, it's lots of eye movement conditions. You've got the children's side of it, you've got the stroke side of it. This is that little eye department is huge.
You feel you are making a difference and you are part of the workforce, which is a lovely feeling, to be honest.
I find it very rewarding. Vision is really important.
Eyes, you know, they're the windows of the souls. What more can you want?
I can recommend to anyone, work with us in eyes.